I've struggled with my weight and my health for 10 to 15 years. I think I'm just super excited to have the surgery done and now to move on to the next stage and just take one day at a time, because that's all I can do to make it successful.
I am at my 6-month mark of a gastric bypass sleeve surgery. I had it done at South Shore Hospital, and it was performed by Dr. Neil Gaucher.
Currently, I've lost 75 pounds, and my goal is 100 pounds.
Surgery is not a cure. It's not a standalone proposition, and it only works for the patients that are really ready for it and they're ready to make all those other investments, both emotionally, psychologically, physically, in terms of exercise, nutrition.
I think, in order for people to understand the process or to even accept the process, you have to do a lot of research. And understand what, the benefits are, what the side effects are. This isn't just, hey, I'm gonna go in and have a surgery and lose all my weight. No, there's so many different, it's like an onion, you just have to peel off the layers, and this is the first big layer.
This surgery changed my life in a lot of ways. Energy level, feeling good about yourself, inspiring and talking to people about it, and what I could, do more in my life, physically and mentally.
There are some metabolic conditions that are so intimately tied into weight and to obesity that the weight loss and the surgery really affect those. And in an even better scenario is that we've done the operation, we've got people through the program before they've developed those problems, before they've developed the diabetes, before they've developed the hypertension.
We have a little bit of a story here. My husband, Michael, he was wounded in Afghanistan in 2008, and that phone call changed all of our lives drastically.
Back in September of 2008, on patrol in Afghanistan, my Humvee got hit by an IED. I ended up as a double amputee, lost both legs.
19 months at Walter Reed, 46 surgeries later, and he came home in 2010.
When I first came home, it was probably 2 years of me adjusting just to the real world. So after taking care of me, it was her time.
I'm going to be 53 years old. And I decided that with everything that's happened in our lives here, that it's my turn. I went to an informational meeting in Weymouth, and I met the great crew there. And I learned about the options that you could do to better improve your life, make a drastic change, and never look back.
This surgery is not designed for a 1-year weight loss or 2-year weight loss. It's designed to have patients have meaningful weight loss for the rest of their lives and improvements in their health and their life for the rest of their lives, and that takes help.
I think with every population you see, especially bariatric, people come to a group setting to exercise for different reasons. It gives them a relationship where they have some trust and they're able to progress in an environment where they feel they're able to do a lot more than they typically would if they were doing things on their own.
As you get further and further out from surgery, you need those little gentle reminders. Okay, I need to focus on my exercise. Okay, I need to focus on the nutrition pieces a little bit more. So it's just a little gentle reminder to get back into the program.
What do you have for breakfast? Turkey.
We always tell patients, you get unlimited appointments with our team. We have set appointments in place, but they can see us as often as they'd like throughout this process. We have such easy access to a wide variety of information, especially nutrition information. It's nice that they have a reliable resource that they can turn to and ask nutrition questions.
So we're hitting the protein goals.
When I first started, I was running, a mile. Then I pushed it to 1.5 miles. And now it's the 3 miles. And, you know, probably within the next month or two, I'll try to push it 3.5 miles and then moving the needle as much as I can do.
I was tired even just getting up out of bed. I was tired of being tired. And now I'm ready to go. 5 o'clock in the morning, the alarm goes off. We're up, we're out, and we're going down to feed some horses and do stuff that we both enjoy.
The thing that makes me want to keep doing this and keep showing up is hearing those stories of, you know, I haven't worn these clothes since my wedding. I haven't felt this good since, you know, I was in high school.
And now, besides the healthier me, I know I can do it and just continue to move on that way.
My Fitbit has been going off since 10 o'clock in the morning every single day, hitting my goal of 10,000 steps, so I'm winning.